It's very common after being ill, sick with a virus that you might lose a little bit of hair. COVID being one of those ones that we are seeing that being a common side effect. I also have seen it happening after people have had like really bad just bouts of influenza or something viral that's like long and icky and they're sick for a while, that then they start to lose their hair. And now they're like, oh my God, my hair's falling out. What's happening? And it's like, well, we always want to ask that question of like, have you been sick recently? Medications are another reason. So if we're linking this back to the fertility journey, something that I have noticed is when women are doing medicated cycles or IVF and we're on a slew of fertility medications, that hair loss can be a side effect of some of those things. So if you're in that world of medicated cycles and you're noticing your hair is thinning or falling out, that also might be something to just think about. Another piece being elevated androgens. So androgens are our male sex hormones. So testosterone and DHEA. DHEA is actually an adrenal hormone, whereas testosterone is our male dominant hormone, but women have testosterone as well. I call women's testosterone a small window of opportunity. We want a little bit, but we don't want too much and we don't want too little. We don't feel good when we're outside of our small window of opportunity. But when androgens are high, that can trigger hair loss. There is a metabolite called DHT that testosterone gets metabolized into. And if we're pushing too much testosterone into DHT, that can trigger hair loss. It can also worsen acne. So two very common elevated androgen signs. And if we're thinking about this from a fertility aspect, if you have elevated androgens, you may have PCOS. If you have elevated androgens, we would want to rule out insulin resistance as well as a potential cause of increasing your androgen production. We'd want to talk about stress because DHEA, if that's high, that's potentially coming from stress. There's a few things that we want to look at. And if you have elevated androgens and it's also potentially impacting your body's ability to actually ovulate, there's a big red flag, right? From a fertility perspective, if you have irregular cycles or long delayed ovulation, and you have hair loss, we definitely want to look at your androgens and make sure that they're in a good range and they're not potentially contributing to fertility issues.